How does a hematoma affect plastic surgery recovery? Have you ever wondered how a hematoma can influence your recovery after plastic surgery? A hematoma is a collection of blood that pools under the skin due to damaged blood vessels during surgical procedures. This condition can significantly impact your recovery by causing swelling, pain, and delaying the healing process. Hematomas are among the most common complications following surgeries like facelifts, breast surgery, or body contouring. During plastic surgery, incisions and tissue manipulation can injure small blood vessels, leading to bleeding beneath the skin. If this bleeding is not properly controlled or drained, blood can accumulate and clot, forming a hematoma. The presence of a hematoma increases pressure on the surrounding tissues, which can lead to discomfort, skin discoloration, and, in severe cases, tissue damage. This includes skin necrosis, which is the death of skin cells, or fat necrosis, which is damage to fat tissue. Both conditions can prolong swelling and bruising, extending your recovery timeline and potentially affecting the final aesthetic results of the surgery. Several factors can increase the risk of developing a hematoma. These include high blood pressure, the use of blood-thinning medications like aspirin or ibuprofen, bleeding disorders, and even male sex, as men tend to have more facial blood vessels. Smoking and engaging in activities that elevate blood pressure after surgery, such as strenuous exercise or anxiety, can also contribute to this risk. Managing these factors before and after your surgery is crucial to minimize the chances of a hematoma forming. Most hematomas develop within the first 24 hours after surgery, but they can also appear days later. While small hematomas may be absorbed by the body naturally, larger or expanding hematomas often requiring prompt treatment. Treatment options can include drainage by the surgeon, sometimes using minimally invasive techniques like liposuction to remove the pooled blood. In some cases, returning to the operating room may be necessary to stop active bleeding if the hematoma is expanding. If not managed effectively, a hematoma can lead to complications such as infection, scarring, and poorer cosmetic results. To reduce the risk and impact of hematomas, plastic surgeons typically advise patients to avoid strenuous activities and manage blood pressure during the early recovery period. Strategies such as using compression dressings, cooling devices, and medications to control blood pressure are commonly recommended. Close monitoring after surgery is essential to detect any hematomas early and intervene promptly. In summary, a hematoma can delay healing, increase discomfort, and pose risks of complications like tissue necrosis or infection, all of which can affect your overall recovery timeline and surgical outcome. Proper surgical techniques, managing risk factors, and timely treatment of hematomas are vital for achieving optimal recovery after plastic surgery. Always consult your healthcare professional for personalized advice tailored to your specific situation.